Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to West Texas View. I'm Johnny Lou Avery, and it is such a pleasure to be here today. And welcome back Daniel Marsh, who's the director of the VA Health Care Systems Hospital in Big Spring, and also Laurie Phillips, who is the Chief of Nutrition and Food Service and temporarily the acting public service of public affairs officer. And they're going to be continuing a conversation they started last week about all of the services and the huge area that they serve and how they are connected to other VA hospitals and then eventually to the Washington office. This is an amazing progression in the history of the VA hospital program, how much, just leaps and bounds that the VA has improved its services to veterans, everything from the pharmaceutical program to treating people all the way from just getting out of service to being an Alzheimer's patient or being in a nursing home, in one of the VA nursing homes. So I'd like for us to start this time. Daniel, you were talking last week a lot about the numbers of areas that this serves and the other hospitals in our area that we do a lot of referrals back and forth with. But I'd like for us to talk about the construction, because I remember when I first moved to the Big Spring area that there was just this giant big one building and then a few little buildings that doctors lived in. And now there's just a multitude of building going on all the time. And I think there's a big construction project going on right now.
There is, in fact. We opened a temporary domiciliary, a 12-bed facility, and our domiciliary program takes care of veterans with substance abuse disorders.
Oh, okay. And
the temporary building was opened because it could give us some immediate care for those veterans. That 12-bed facility stays full. We opened that about a year ago, a little over a year ago now. We also had received approval to build a new 40-bed domiciliary very close to the temporary facility. And so we're in the process of that construction right now. We expect that construction to be completed by the end of December of this year. And they're really ahead of schedule right now. It's going to be a very new state-of-the-art facility. We'll be able to expand our services for homeless veterans that are in need of substance abuse treatments. It's going to help them make the transition back to a normal life, to have a job, to be able to hold a job, and to not fall prey to all the maladies that come with addiction disorders. And we've been very successful in that program so far. We've had a few of the veterans that we've actually hired out of this program who are now employees at the West Texas VA, and they're great employees. We've had some that have gotten jobs out in the community, and it's just been a real successful program for us. And with the increase up to 40 beds, we'll be able to take care of that many more veterans in that particular program.
So you've really broken the cycle.
Yes,
for those.
we have. We absolutely have. We're also in the process of creating a whole new mental health service on our 4th floor of our main campus. We're basically going to be cleaning out the entire 4th floor and turning it all into new mental health services, which will greatly expand our capacity there. We're in the process of bringing on a new mental health chief who's coming from another VA who's got extensive experience with a 140-bed domiciliary, and so he'll be a very welcome asset to our facility to help our chief of staff improve our clinical programs. So we're looking forward to getting him there as well. In addition to that, we have another $25+ million worth of projects that are going on at the West Texas campus. Some of those involve, like our infrastructure of our facility, which has needed some attention for quite some time. We've gotten tremendous support from our network director, Susan Bowers, and the whole capital asset team that worked for the VISN in getting those projects funded and getting them started. So we have a number of infrastructure projects that are going on. We also have a number of other projects that are going to improve our safety aspects of our facility. Some of our pavement needs to be replaced and things like that. So we're very much looking forward to getting those projects moving and improving the overall facility, not only for our veterans, but also for our staff.
Well, you know, you bring up a point that, and Laurie can probably speak to this since she's a long-time Big Springer, is the VA hospital has always had a strong history of working with local agencies. You already mentioned that you work with the state hospital, and I know that you do a lot of things with Scenic Mountain, but you also work with Salvation Army, and they help you identify some of these homeless veterans and veterans that are in need. And so that's just been a wonderful partnership that you've got within not only the Big Spring community, but Odessa and Abilene and the other communities that are helping in the outreach. And that's a really important thing, is that you're not just sitting back waiting for them to stumble in your door. You're out actually trying to make sure they understand what is available and what can be an opportunity for them to get the best health care that they can. But I'd like for you to talk a little bit about the food service and how that operates, because food service has really changed in institutions over the years, whether it's a school system or a private hospital or what.
Right. You know, hospital food often gets a bad rap, so, you know, we work really hard to break out of that stereotype. We have two really distinct features in our operation. We have the food service component, where we're serving the patients, both our community living center patients and our inpatients and our new domiciliary patients that we spoke of. But we've also got a great team of registered dietitians that also provide nutrition education and counseling for our patients that may have chronic diseases like diabetes. We've got one of our dietitians is a certified diabetes educator and works very closely with the team of physicians and pharmacists to provide overall care for our veterans to try to improve their blood sugars and all their tests. And we have a really strong weight management program as well, where we're working with the veterans to try to help them control their weight or get their weight to a good level.
And you also have a canteen, or whatever you call it, to serve the families of your patients who need to eat, and so that is another side thing that you have to be in charge of. We're going to take a break right now, but we'll be back in just a minute and continue this conversation with Daniel Marsh and Laurie Phillips from the West Texas Big Spring VA Health System.
Stay tuned. West Texas View will be right back.